I'm Dr. Charles Moak, and this is my video about what it means to me to work at Allure. I want everybody to make a movie. It should be somewhere between, say, 3 minutes and 6 minutes. And tell us what it means to you to work at Allure Medical Spa. There's no real rules on what it can be about. It can be about anything. I want to tell you a little bit about the history of Allure. So we started really in 2003. A lot of times we're thinking about our 10-year anniversary being 14, but we actually started in 2003 in Harrison Township. I rented a couple office suites from a doctor. There's a family practitioner there. And I'd go there on Tuesdays and see patients. We were doing primarily hair removal. We also did a procedure called mesotherapy, where we inject stuff in the fat to make it shrink. And then about 3 or 4 months into it, I realized there just wasn't enough room. We were outgrowing our capacity, so we moved here to 26 Mile Road. And we moved into an orthopedic office where they had themselves in 6 rooms. They had an ophthalmologist in 3 rooms. They had 3 extra rooms more capacity than they needed. So we moved in there, and we were able to be there 5 days a week, 6 days a week, whenever we wanted to be. Well, time went on, we grew, and the ophthalmologist decided that location wasn't working for them, so they moved out, and we moved to 6 rooms. And then we kept on growing and growing, and we really needed more space. And right across from us, there was a podiatrist, a foot doctor, and they were vacating, so we agreed to take over their lease and gave us another 5 or 6 rooms. Kept on growing, and then there was an obstetrician gynecologist office down the hall, and we used to call that East. So now we had North, South, and East. And East gave us about another 5 rooms or so, and we kept growing. And then we were, at that time, we were having lunch in a small patient room. It was about 8 by 10, and we'd take turns going in there and having lunch. So we wound up getting a cardiologist to move out, and we took their whole suite over, made that into our lunchroom. And that was back probably around like '07. We still realized there was problems, growing pains. So we started looking at adding on to the building, but it wasn't practical. So I met with the hospital, and we decided to jointly develop this building that we're in now in Shelby Township. It's about 65,000 square foot, and it gave us more than enough space to expand. Even though we're bumping up against capacity now, we addressed that back in 2011 by opening up Livonia. We realized that there was people that would probably want to come and see us, and we're too far away, so that they would go to Livonia. And I was afraid at first that that would potentially steal patients from here, from Shelby Township. So I put it kind of as far away as I could in where I knew patients weren't coming from, and lo and behold, it got busy. They're doing quite well. So then in 2013, we decided to move into Clarkston, try to get that Flint area, sort of the northern areas, and sure enough, that's been growing as well. We opened that in 2014, even though we started looking at it in 2013. And that's been great. So then now we're embarking on our next stage of growth. We're actually going to develop 3 more practice locations over this winter, or perhaps into next summer. We're going to be downriver in Southgate, Warren, Michigan, which is sort of the east side, and then we're going to be in Bloomfield Township, it looks like. And those should be opening soon, and it gives people opportunities to grow. So that's the practice building location. Let's talk about how the practice evolved, okay? Back in 2003 or 2004, let's say, I was involved with a doctor and a nurse that wanted to start laser hair clinics. And I put the money up to buy equipment. And it didn't go so well. The business was sort of, you can't make it in a laser hair business. It sort of was about 5 years past its peak because there were other chains moving in that were doing hair removal successfully. And they could sort of undercut us, and it wasn't in a doctor's office, so that didn't work out. So he more or less walked away, said I wasn't working out. And simultaneous to that, I was at an emergency department meeting in Las Vegas, and I saw this international aesthetic or Pan-American aesthetic conference. I kind of moseyed on in. I was showing a friend of mine how you can get through security and get through the people that are checking the badges by acting like you're angry and in a hurry. So you like you're really in a hurry. In fact, I read that in a James Bond book once too. You just act like you're in a hurry and people won't disturb you. So I go into this meeting, and they're talking about mesotherapy, which is actually an injectable medication that would dissolve fat. Didn't work great, but it worked. And in 2004, we became the first place doing mesotherapy in Michigan, and probably one of the first 5 doctors doing it in the United States. So we got really busy with that. And that actually catapulted us in order to be able to learn other things. So now I had this big mesotherapy practice. Every doctor in America that's doing cosmetic procedure wants to know about it. So a guy, for example, who is doing the most vein procedures in the country or in the world, taught me how to do veins, and I could teach him how to do the mesotherapy. And the most successful, that was Dr. Hunt, Jeff Hunt. And then the most successful Botox doctor that anybody would recognize as like a leader, national speaker, Dr. Martin Braun, he came out to my office to learn how to do mesotherapy. In exchange, I taught him how to do, he taught me how to do the Botox and fillers. And that's what really led to our huge growth in the veins and in the Botox fillers, was me having mentors that were at the peak of the business. Normally when the doctor's getting trained on something new, they don't teach you this in residency. So if you might get a little exposure to it, but you don't get taught these things in residency. And if you do get taught, it's in some course by somebody that maybe is not a leader. They just know how to do it. They're passing along something simple. So then the mesotherapy is going, the veins are going well, and I decided to do more cosmetic surgery. So I met with some of the top cosmetic surgeons in the country, and they taught me how to do procedures. For example, when I was learning to do the breast augmentation, a friend of mine, Dr. Yoho, came out, and we did like 10 or 15 cases in 2 days. Just cranked them out, and he was able to show me how to do this quickly and efficiently and get skilled at it in a very short period of time. When somebody does say a plastic surgery residency, they might only get like 1 or 2 or 3 breast augs on their own. So I had really like a accelerated residency program, let's say. Same thing with eyelids, facelift surgery, same thing. I just learned it from the experts. Other things have grown as well, like the cool scalp sensation. That was sort of on in late 2010 to 2012 phenomena. We have to accept the fact that some of these things are going to come and go. Sometimes there's concerns about what's going to happen with healthcare reform. How's that going to impact us? Well, we're going to adapt. That's how it's going to affect us. It will affect us. Everything's going to affect us. We can focus on what we do best, which is becoming very proficient at doing the procedures and providing to get best customer care. Now I want to tell you about the buildings. We talked about that, how the practice developed. It's made us one of the largest vein practices in North America, one of the largest cosmetic surgery practices in North America. And we did it through a very specific thing. We're going to talk about that. So, as a physician, the way I was able to develop my skills is I went from working in a hospital where I didn't have any employees. I worked on my own. I was an independent contractor. Even the other doctors, we were just sort of like associates, but we didn't have a partnership. We made individual determinations. We bought our own insurance and saw patients and billed them ourselves. And then I get in a situation where now I have employees, which was really a different thing than I've ever been exposed to. I've had other businesses in the past, but we didn't have employees. And I was focused on growth. And I look now, every year, I learn things more and more, and I've been focused on learning to do my job better, which is to be a leader. Okay, and that's what my Allure job is. And one thing that I have talked to my wife about, and she kind of had a hard time with accepting this, and I said, Natalie, for us to grow our business, I have to stop being the doctor, okay? Because if I'm the doctor, the other doctors can't really grow as well. So I'm going to be more of a doctor mentor and a staff mentor. Not that I'm not going to see patients anymore, but our growth will not be based on my production. It's going to be based on our production, okay? So that's why I'm trying to pass things along and teach other doctors to do things, not because I don't want to do them, but if I do them all, then we don't have a big staff with a lot of jobs, okay? And then I want to talk to you about how our practice philosophy has evolved over the years. The practice started out as just an opportunity. I was doing the mesotherapy and it was kind of fun. I was still working at the hospital. I sort of worked part-time at the hospital and part-time here until about 2006. So from 2004 to 2006, never even took a paycheck. In fact, I put every penny that we generated back into the business because I was focused on growth. And I thought my job was to really learn how to do procedures real well, become very proficient at them. That's what I did. I focused on that. And then when we started growing, I realized my job was more than that. It was actually to become a leader to the organization. So I started reading leadership books. I read about one a month to better understand about being a leader.
Where you at, Chris? Chris? No Chris?
In fact, a leader would be defined as the person who communicates their vision and gets people to carry it out, okay? You might be in the billing department and you realize something is going wrong. Maybe the paperwork's not being filled out. Well, you're now the leader of that job, and your job is to communicate your vision or your task to other people so they carry it out. You might be in a leadership role somewhere else, so you should think about your projects as being your opportunity to be a leader. So then the practice evolved from doing the procedures. My practice evolved from doing the procedure to becoming in a leadership role, but how did our practice evolve? Well, in the past couple of years, I've had a much better understanding of what we are at Allure. And we tried to come up with fancy taglines, and we did, helping you bring out a more beautiful you. But in reality, we're not really about the Botox and the filler, or the surgery, or the veins. We're not about being the biggest and the best there is. We're not about creating the best customer experience. These are all things we do, okay? So we want to create a great customer experience. We want to be the biggest and best at what we do. We want to have people amazed. But that's the tool we use to carry out our main, say, philosophy in our practice. Allure Medical Spa is about us. Okay, it's about us. I want to see people with good jobs, that are happy coming to work, that have an opportunity to grow, and have an opportunity to learn. The practice is about us, and I want to be able to see people develop and grow with the practice, assume different roles. We've had individuals that came here in one job, and they're doing something totally different. And that's about growth. And I want you to realize that this is the place that you come to work, to give great customer experience, to help us grow and do sales or answer the phone or be polite or put out fires or take care of problems. And we do those things in order to grow us, okay, give us a better opportunity, to give us a better job. And when we're doing these things and different educational things, I'm really focusing on helping you develop yourself personally and professionally. One thing I want to take as an initiative in the next couple of years is for our office to become a more giving office. In the past, we would adopt families and get them Christmas gifts, and somehow that organization they put together sort of fell apart. So I'm looking to figure out how can we do this like as an automatic. Everybody thinks about that. And that's part of developing yourself as well. Because if you make yourself have say a better job and learn something and learn a new skill, you have more job satisfaction. If you learn how to really give great customer experience, you have great job satisfaction. If you get more time off and make more money, now you have potentially have more family satisfaction. And if you give, you have more spiritual satisfaction. So this is all about growth, and that's why we're doing these things. So I want to take you through a little journey of what Allure has meant to me. Now, not everybody's in this video because I just started it, a few days ago, and I was working. So I'm going to show you some things that I've observed and kind of caught people off guard. And then we're going to go through a little photo tour of the office. Okay, Tanya, how long ago did you start here?
7.5 years ago.
7.5 years ago. What was your first job?
I started at the front desk.
And then you went to billing?
Then to billing.
And then what happened after that?
Then I went to nursing school. And you were nice enough to work with me while I was in nursing school. And then offered me a job right before I graduated.
And now you're a sedation nurse.
Yes.
Thank you. So Crystal, how long have you worked here at Allure?
11 years in March.
No laughing. Crystal, how long have you worked here?
11 years in March.
And you came here and started doing what?
Medical assisting.
Because you were a nurse assistant, weren't you?
Yes.
And what happened after that?
I just grew with the practice, and then I went to school, and now I'm working on my certification for surgical tech.
Fantastic. Angie, tell me what you're doing with Mark here.
Right now we're doing hair transplants for Mark, trying to replace some of the hair he's lost through male pattern baldness.
Great. And what are you doing, Megan? You're making some PRP?
Yes. We drew some blood from Mark and we spun it down multiple times to extract the growth platelets out, and we'll be injecting them into his head.
Did you ever think you'd be doing this, Megan?
No.
I'm learning about refunds, incentive programs, verifications, all sorts of things.
And Joanne, what are you doing?
I'm actually refunding a payment right now.
And what are you doing, young lady?
I am finishing setting an appointment.
And Melissa, you're not supposed to be up here.
Hi, I know I'm not out of my box. I'm looking for a chart to build something out correctly.
So this is our call center, our communication center. Hello, ladies.
Hello.
And what are you doing today?
I am confirming appointments, answering phone calls, selling consultations.
And Lisa, you were working on a project.
I am working on a text message project to text message blast segments of our database.
For what purpose?
Bring in new patients.
Exactly. And what are you doing today, Jackie?
I'm working on emails, incoming leads from the area and maybe surrounding areas to try to bring them in to sell appointments.
Edit me
And Lisa, what the hell are you doing up here?
I am trying to have them find some new rock stars to hire up here, so I'm giving them all the resumes for our next job fair.
Thank you. Okay, Chris, and you have your patient here. Tell me what procedure you did on her last month.
We did the photodynamic therapy to help with her overall skin appearance from sun damage.
Are you happy with it?
Yes,
Did she do a good job?
absolutely.
Chris, did you ever think you'd be doing that kind of stuff?
No,
Doing a great job.
thank you.
Okay.
So Michelle, how long have you been with Allure?
7 years almost.
And what do you do now?
What do I do now here?
Yes.
I work in the HRT department.
And you came here, did you ever think you'd be doing that?
No, never. I started up pulling stockings up on patients in the vein department, and now doing a ton over here in the HRT department.
And Stephanie, you came here to do the hormones. And what do you do now?
Hormones and vascular veins.
And you ever done procedures like that before?
Not the veins at all.
How do you like it?
Actually, not the bioidentical hormones either. Love it. The veins work great too.
Thank you. These are our dermatology ladies. So tell me what you guys are doing today.
Well, today we are seeing patients.
And how about yourself? What are you doing?
I have seen patients and worked to book different appointments.
Great. And doctor, you are a new doctor with Allure. How do you like it?
Oh, I love it here.
Thank you
It's
very
close to home. Everyone's nice. Patients are great.
Not bad deal. Okay, Nanette, tell me what you do here.
I am a registered vascular ultrasound technician.
And what are you doing right today?
We are doing a endovenous laser ablation.
And you're training somebody.
I am. This is Angel. She's been with us for a few months now.
And here's our
She's
nice
doing
patient
great.
helping out. There you are. And so, how long ago did you start working here?
10 years.
And what were you doing when you first started here?
Originally, I was answering phones, contingent for you, and then moved up to working at the front desk. Then I was a medical assistant, and then went back to school, and now I'm a tech for you.
And now you're training somebody to be a tech.
Yeah, look at that.
All right, thank you very much. So what does it mean to develop yourself? Well, developing yourself means a lot of things. It might mean that you've learned to get better at your job. It might mean that you've learned how to do a different job and take something else over. It might be that you develop into a leadership role. That's not for everybody, but some people are very good at that. And it might be that you just develop at getting things done extraordinarily consistent, or maybe you're good at doing systems, something that you know you're really good at and you get better at it. But also it has to do with developing your family. Your nuclear family, your mom and dad, your children, whoever it is. When I talk about doubling our business, the reason I'm doing that is because I want to have something that I can measure. I intentionally want to grow the business, and if I put my head doubling it, that sounds like something that is maybe that's like not achievable. Well, in reality, if we grow our business by 17% per year, we would double the business in 5 years. If we grow by, say, 26% a year, we would double it in 3 years. Because every time you increase it by a certain percentage, you get sort of like that compounded interest effect, okay? And the reason we're doing that is to make our lives better. And how do we do that? Well, we're gonna have a better job, more job security if we double, obviously. We're obviously gonna have more people working for us. So that's something good that we can offer jobs to our community, people who live right near us, our neighbors, our friends. And also, I want to be able to have, personally, more time off. And I want to make a good living. I want you to do the same thing. I want to get a situation where we can all earn more money for our time. I have some specific things in mind and ways we're going to do that. And I also want you to be able to enjoy more time with your family. But the only way that can occur is if we become more productive, okay? If I snapped a switch tomorrow and said, okay, everybody gets 10 weeks off, we're going to have some serious financial problems here in the office. But maybe in years from now, we could look at expanding that time off maybe even a year from now, we can keep looking at expanding our time off. And what happens when you have more time off and make more money? Well, you have the potential for more family life. You can spend more time with your kids and your family, take vacations. Vacations have been always very, very important to me. When my kids were little, my favorite thing to do was to go camping, backpacking, go in the ATV, go somewhere. And when the kids were real little, Sarah and Kevin and I would go backpacking. I think Sarah was like 6 or 7 years old and Kevin was 8 or 9. And we went to the Rocky Mountains and we climbed a very high elevation with our stuff on our back. And I could see Sarah was getting tired. And she had a little pack because she's a little girl. And I said to her quietly when Kevin was going to the bathroom or something, Sarah, I'll take some of your stuff out of your bag and we won't tell Kevin. And she looked at me and said, no, Dad, I want to do it myself. And that was a profound growth vision for me to see my daughter say, I want to do it myself. And my kids have done many things like that that make you proud. You've had the same experience. And then as the kids got older, we didn't do as much stuff together. We still see them. We were in Hawaii to visit Kevin for Thanksgiving. It was interesting that Mike didn't want to do the stuff he normally wants to do. Kind of wanted to, kind of hang out and read and stuff like that. I'm like, you're like an old man already. I want you to be playing. We should be scuba diving. But that's how families change. And then you wait for the next generation. Now Natalie and I spend more time together going on vacations. I really enjoy that. We've done a lot of things with going on the motorcycle trips and going to the Caribbean, going overseas. And that's something very valuable. And I want to be able to do more of that. In fact, I'd like to be able to take time off when I want to and not worry about the business. And the only way that's going to happen is if I focus on doing the other stuff, which is developing us. Okay? And you can think of it the same way. Teach somebody to do your job. You have more ability to do something else and learn something else. And even when we get more time off, you can be sure that things are still going to happen. And the only way that occurs is by us becoming a growth-based office. So this is my video, and I want you guys to make yours. Now, ideally, virtually everybody makes a video. And again, it should be about 3 to 5 minutes long, 3 to 6 minutes long. The reason this one's longer is I'm trying to explain some things to you in addition to doing my video. And I'm not going to be one-winded gift, so don't worry about that. But the more videos we get, the more value I will assign to the prize. You'll have a lot of questions like, what's the prize? How do we submit them? When are they due by? What happens if I get some problem? I can answer some of those questions, but I can tell you if my Colby score, that my follow-through is like a 2. Okay, so I'm probably not the best person to ask about that. So I came up with the idea, but all the other stuff you should talk to your leadership team. May come up with a solution for it. But Quentin will help you organize your photos. He might even I'll help you do an interview like this if you want to. But I want you to really do it by yourself mostly. And then the technical stuff, you can take it off your iPhone and make it into a nice video. You can have coloring in there or writing in there or pictures or anything. And I want you to explain what Allure means to you. Now the prize, I'm hoping to get enough video so I can justify that the gift is a car, okay? So right now it's probably like a leased car, but if we get enough videos, it's gonna be just a car, okay? Something that you get to keep. There's probably gonna be a taxation thing on that. Again, I don't know, my follow-through's a 2, I didn't look into that, but I'm suspecting that, yeah, there'd be taxes on a car. So that is the gig. So make your videos, and good luck.